Now, the Canadian Association of Gastroenterology put out a statement on doing procedures during COVID, and I know that you were recently involved in developing a position statement, if you will, for clinics to reopen with the Ontario Association of Gastroenterology and also the OACE. Could you tell me a little more about that? And now that these clinics are going to play a critical role in the catch-up, if you will, of all these elective cases, what type of precautions should they be considering?
There's been this whole dialogue between IPAC, which is sort of the provincial infection control group, and all the GI groups, AGA, OAG, CAG, every European GI group, about what kind of procedure. For sure, gastroscopies are, let alone colonoscopies, in terms of are they high-risk procedures or not. And there's no agreement between our infection control people and all of the organizations that tell us how we should do it. So for the most part, all the GI organizations have said these are high-risk procedures, and our IPAC says they're not AGMP, aerosolizing procedures, so that we don't have to be quite as worried about them. So because of this difficulty, and this difficulty was experienced at every hospital around the province in terms of discussions about PPE with their local infection control people, we've all went about how are we going to do this safely. So when the government asked everybody to back off elective procedures back in March, everybody closed I shouldn't say that. I think the majority of people closed down their outpatient endoscopy facilities. I don't know for a fact that everybody did, but most did. And we weren't doing anything. So we all had rent. We still had staff, which we had, some were laid off. We had all the issues of every small business in the province. We were generating zero income because we were not doing any procedures.
Right.
Only now are we figuring out whether we're even getting that rent relief from the government, which I think we're finally going to get, but that's 3 months into it already. So big issues for all of us. Nevertheless, we decided at some point we were going to have to start up. As things started quieting down, we felt it was safe to do so. And so we, as a group, every group was sort of looking at it separately. We took sort of the one we had been working, and we decided to provincialize it. I don't know if that's a word, but make it so that it was the same. It is now the same approach for all of us, right? So that one, there's safety in numbers. Two, we get a bunch of people who all are interested in quality medicine and making all the rules that will protect our patients, protect our staff, protect us, and just make sure we do this safely. And it's rejigged everything we did. So we went about from the second you talk to people, how you consent people, how you bring people into your facility, how many people you have in your facility, how you recover them, and how you keep them, so how you distance them and flow. And so it was reduced flow. We all only decided to do colonoscopy in the first.
So no gastros at all, right?
No gastros. We all decided, and how we're going to flow colonoscopies. And that's pretty much what every facility did. I think everyone's up and running now in some capacity. We had reduced days, reduced numbers, but we're sort of building up. And now we're in the midst of moving on to our phase 2, where we're going to start doing more procedures, because we've done whatever we said, and we were only limiting it to symptomatic people. So we weren't doing average risk screening. We weren't doing your 5-year surveillance and all those things. And so we have now had another meeting where we're probably, as of July 6th, so the week after the long weekend, people will start moving back towards normal. I think it's been a month since the government said we should start thinking about this. And the clinics for sure have cleared out, I'm sure, most of their symptomatic patients, since the majority of patients coming to clinics still are routine screening, surveillance, and some mild symptomatology.
One of the things I noticed in reading the statement was there was still quite a concern about availability of PPE and kind of conserving it, and that the lower patient flow, could partly be attributed to that as well. Is that still an issue?
It depends what you want, but I think everybody. So the OAG, we took it upon ourselves to try and secure PPE for whatever clinics wanted. We joined with the Ontario Associate Clinical Endoscopy group, and the two groups did both the guidelines and the PPE acquisition together.
Okay.
And so we secured a way to get masks, and face shields, N95s if people wanted or could get them. They were harder. And then we also got gowns, and the OAG procured almost 2,000 gowns for people that then purchased for themselves. So we took it upon ourselves to make sure as an organization we got people who wanted PPE, they could have it. People could do it on their own for sure, but at least we secured that. And I think everybody's got the PPE they need for gastros. And then a discussion about N95 masks come back, and that'll be, I think, not as consistently applied across the board as what the first wave was.
Where can people find the statement that was created on reopening clinics?
So I'm sure it's on the OAG website, and I'm not sure if the Ontario Associate Clinical Endoscopist has a website, but they have it too, and any member can reach out to them and get it from either organization.